Welcome back. To continue our discussion on cervical cancer, joining me again, Dr. Eric Wallace, Associate Professor, Internal Medicine, the University of Oklahoma School of Community Medicine, and OU Physicians. Let's jump in because this is just blowing my mind, if no one else's. We stopped talking about the age 30. So at the age of 30, this new recommendation now is every 3 years?
Correct. So once you get to the point where, let's say you're a woman who's 21 and you start your cervical cancer screening and you get your pap smears and you get it every 2 years and those have been negative. Once you get to age 30, you can start spacing those out to every 3 years instead of every 2 years.
Well, in the show we did on breast cancer, you happened to mention that the older we get, that is a risk factor. The older you get, the more at risk you may be for development of breast cancer. Does that apply in cervical? The older you get, are you at greater risk?
Yes, you are, because...
but if you are, and tell me the because part, and then add this to it. If you are, then why is the recommendation for every 3 years? It's getting longer instead of shorter. So tell me the because.
Right.
You are at greater risk the older you get because?
Because you've had that virus for longer in your system, and because the longer that virus is there, the more likely you are to develop cervical cancer later on. However, what the evidence shows is that you still achieve the benefit of detecting cervical cancer and surviving cervical cancer with appropriate therapy, whether you do it at 3 years, 2 years, or 1 year. The evidence shows that that's the same benefit that you get. The disadvantage or the harms of doing more frequent screening, say on a yearly basis, is that you're going to have more what they call false positive tests, or you're going to find those precancerous cells that the body still may heal on its own, number one. Number two, you're going to be sending more women for procedures that have certain complications, certain risks involved. For instance, young women who have precancerous cells and you do any type of procedure to remove those cells, especially any type of surgical procedure, you're going to increase that woman's risk of preterm delivery if they choose to get pregnant and have a baby. So there's certain complications involved even with doing those treatments, and there's no way to really accurately predict which of those precancerous cells are going to develop into a malignancy and which ones are going to heal and regress. But the bottom line is that the spacing out to every 3 years has been shown to still save lives from cervical cancer and to minimize the risks and harms associated with cervical cancer screening.
Okay, so is this from the age of 30 forward, or once you get to 50 or 60 or 70, now you're talking about every 5 years, doctor, or does it become shorter?
No, you're still talking about every 3 years.
Still every 3, okay.
And then actually stopping pap smears between the ages of 65 and 70, because that's where they show you know, the risk of developing cervical cancer after that point is pretty low. Women are not continuing to expose themselves to the HPV virus through sexual contact with multiple partners for the most part. But the guidelines from multiple organizations recommend stopping the cervical cancer screening between the ages of 65 and 70.
Okay, let me ask this question because we do have people living a lot longer, healthier, and we have healthy 65-year-olds that may look like they're 55-year-olds. If the person is still sexually active, even in their 60s or middle to late 60s, would the screening recommendation still stand of every 3 years because they are continuing sexual activity compared to not?
Correct, and that's where it gets into that individualized risk assessment and discussion with your physician. The reason those lines are drawn in the sand for the upper age limit of breast cancer screening at 74, the upper limit of cervical cancer screening at 65 to 70, is that there's just not a lot of data and evidence beyond that age range. And as you get older, you're more likely to die of other causes, so heart disease, stroke, and so forth. So the benefits of screening start to fade away as you get into a much older age.
Okay, now let me ask this question. Now, we have the HPV vaccination that's available for young women, young girls as young as the age of 9, the recommendation.
Correct.
If you said, and some people may be wondering about this, if you said that you don't even need to start cervical screening until the age of 20, 21, and the risk factor in terms of developing it younger than that are much lower, And if the female did develop that, the likelihood that with a strong immune system she would be able to clear that herself are pretty good. Why in the world, people are wondering, is the medical community recommending these HPV vaccinations for young girls, especially as young as age 9?
Okay, so with the new vaccine that's out, and Gardasil is the name that's associated with the vaccine that's out there. The recommendations for that are to give the vaccine, or consider giving the vaccine, for females between the ages of 9 and 26. That's a pretty broad age range, but the point of a vaccine is that for it to be effective, you want to give it at an earlier stage, and in this case you want to give it before a female is ever exposed to the human papillomavirus through sexual contact. So if you're a 9-year-old girl and you get the vaccine, your immune system will be primed and ready to attack that virus much more effectively when she becomes older and has sex for the first time. Now, if you're older and have already had sexual intercourse, you can assume you've been exposed to the HPV virus, and that vaccine, although it will still be somewhat effective, may not be as effective at preventing the development of cervical cancer. But another point here is that even if you get the vaccine these days, it may reduce your risk of developing cervical cancer, but the recommendations still stand to do surveillance with Pap smears for cervical cancer screening. So whether or not you had the vaccine, it's still recommended that you get Pap smears every 2 years from 21 to 29, and then every 3 years from 30 to roughly 65, 70.
Okay, and that would also therefore mean that under 21, there's no recommendation for Pap smears at all.
Correct. That is the newest recommendation.
That truly blows my mind, I must say. That truly, yeah, I have a lot of concerns about that, but but that's the recommendation that we're getting. Now, in terms of, people may wonder with the HPV vaccination and Gardasil, in terms of, you're talking about exposure and what that would help boost the immune system's ability to attack, etc., like that. With this vaccination with Gardasil, does it protect from all types of HPV, or are there certain strands that it does not protect against?
The strands that have been selected for, so when they developed this vaccine, they mainly wanted to target the certain strains of the HPV virus that increase one's risk of developing cervical cancer. And there's only certain strains that do that. There are other strains that either don't affect you at all or lead to the development of potentially genital warts. So with this vaccine, it actually helps, it's been shown in the studies to lower your risk of developing genital warts, which are disfiguring and uncomfortable but aren't cancer causing.
Now with this, and before we go to break, a really quick question. If the parent elects not to have their child immunized with the Gardasil, to take this vaccination, is that child at greater risk of developing potentially cervical cancer and not being able to clear it, or is it the same thing you're saying? If the immune system is strong, then you're going to be able to clear it, and the vaccine is like a boost to it, but it doesn't mean that you can't still do it.
Right, so the vaccine is still relatively new, and there's not enough long-term data out there to show what happens 10, 15, 20 years down the road in women who do get the vaccine. So there's still a lot of uncertainty at this point. That's why they still recommend continuing with the current recommendations, or actually the newest recommendations on cervical cancer screening.
We'll take a really quick break and come back and look at a few more other issues related to cervical cancer. Please stay with us. We'll be right back.